I love this place, right? I love what we do. I love my students.
Here at the Quinn, we have this motto that we live by, which is the we over me.
When one hurt, we all hurt.
The student body at Paul Quinn College consists mostly of students from urban America.
A lot of the students come from cities or states where they might not have otherwise been able to come to college, or come from backgrounds where they've experienced a lot of trauma.
We know that there is trauma associated with poverty. We know that children who grow up in poverty are more likely to develop health issues, to have mental health issues, to not be able to fully benefit from access to education. Consequently, generations of people have gone uncared for, but it doesn't mean it has to stay that way. There's a stigma attached to mental health in Black and brown communities because it's seen as a source of weakness. So our students were hurting.
President Sorrell reached out to UT Southwestern and said, I'm noticing that a lot of my students might be at risk for some sort of mental health issue.
We have tried to create an environment with the help of UT Southwestern where our students can talk freely about, I need to go see a counselor, I need to talk to someone. And it's exciting, right? It's exciting because we're going to help people be better. We tell them the only mistake you can make is sitting in pain and not asking for help.
From there, we screened all of the kind of first-year students at Paul Quinn over the course of 2 years. From that assessment, we were able to kind of figure out what disorders or things people might be struggling with on campus, and then referred them to the clinic out of there. And we see people for everything from anxiety, depression, to substance abuse and trauma. And then we also see students for individual therapy as well as medication management.
I got so overwhelmed with fighting with myself, fighting by myself.
I was tired of feeling worthless and alone.
It wasn't until I started that first session that I realized how deeply hurt that I was. I felt relieved to talk to someone who I knew for sure wasn't going to turn their back on me.
Getting kind of student buy-in and just hearing them get excited about it, we can, as residents and faculty, we kind of start the program, but they're the ones that kind of keep it going.
I couldn't believe the feeling that I had. That feeling was peace. I felt like someone actually wanted to listen to me and they cared about my well-being. What if I lost my life because I didn't go get help?
We are a better place, we are a more caring place, we are a healthier place because we have had access to the care that UT Southwestern has provided. I just want to say to UT Southwestern, thank you for putting your arms around us. Thank you for loving my students. And thank you for always going above and beyond whatever it was that we were supposed to be doing to be the institution that we need and in effect be the institution that this community needs.